Greetings from Blissful Broadcast. Today we delve into a critical topic: cervical cancer. This is a type of cancer that arises in the cells of the cervix, the lowermost part of the uterus that connects to the vagina. Worldwide, it's the fourth most common cancer in women, affecting hundreds of thousands each year. Cervical cancer often has a profound impact on women's health and well-being. It can be life-altering and in some cases life-threatening. However, it's also largely preventable and, when caught early, treatable. Noteworthy medical facts underscore the seriousness of this issue. For example, according to the World Health Organization, nearly 90% of cervical cancer deaths occur in low- and middle-income countries. This illustrates the importance of spreading awareness and understanding about this disease. Understanding cervical cancer is the first step towards prevention. So let's delve deeper into this subject and unravel the signs, symptoms, and treatments of this significant health concern. Early detection of cervical cancer can be life-saving. Let's discuss the signs and symptoms to watch out for. First off, it's important to note that early stages of cervical cancer often do not present noticeable symptoms. This is why regular screenings are vital. However, as the disease progresses, there are certain signs that may begin to surface. One common symptom is abnormal vaginal bleeding. This could mean bleeding between periods, after sexual intercourse, or after menopause. It's not uncommon for women to experience irregular bleeding, but if it's persistent, it's time to consult with a healthcare professional. Next, we have pelvic pain. Now, this isn't your typical cramp-like discomfort that comes with a menstrual period. It's pain that is felt deep inside the pelvis, often described as a sharp pain or a dull ache. Discomfort or pain during sexual intercourse, also known as dyspareunia, is another symptom that should not be dismissed. While there are many potential causes for dyspareunia, it can be a sign of cervical cancer and should be checked out if it's a recurring issue. Abnormal vaginal discharge is another sign to watch out for. This could be a discharge that is heavy, has a foul odor, or contains blood. Unexplained weight loss and fatigue can also be associated with cervical cancer. While these symptoms are common to many conditions, in combination with the symptoms mentioned earlier, they could indicate the presence of cervical cancer. Lastly, in advanced stages of cervical cancer, there may be issues with kidney function, swelling in the legs, or problems with bowel or bladder control. Remember, these symptoms do not confirm cancer, but they are warning signs that should not be ignored. If you or someone you know is experiencing these symptoms, it's crucial to seek medical advice. Early detection and treatment can make all the difference. Knowledge is power. By understanding these signs and symptoms, you're better equipped to protect your health and take action when necessary. After all, it's your body, and you know it best. Stay informed, stay vigilant, and stay healthy. Now that we know the signs, let's talk about prevention and treatment. Prevention is always better than cure, and this holds true for cervical cancer too. There are several steps we can take to decrease the risk of developing this disease. Firstly, the human papillomavirus, or HPV vaccine, is a major player in cervical cancer prevention. This vaccine is recommended for both girls and boys, typically around the age of 11 or 12. It can also be given to women and men up to the age of 45. The HPV vaccine protects against the types of HPV that most often cause cervical, vaginal, and vulvar cancers. Next, regular screenings are crucial. Pap tests or smear tests can detect changes in cervical cells that might lead to cancer in the future. An HPV test, which can be done at the same time as a PP test, looks for the virus that can cause these cell changes. Regular screenings can catch potential issues early when they're most treatable. Another key prevention strategy is practicing safe sex. Using barrier methods of contraception such as condoms can help reduce the risk of HPV, which in turn reduces the risk of cervical cancer. Now let's move on to treatment options. If cervical cancer is diagnosed, the treatment plan will depend on the stage of the cancer, the patient's overall health, and their personal preferences. Options may include surgery, such as a hysterectomy or removal of lymph nodes, radiation therapy, and chemotherapy. Surgery can often remove early-stage cervical cancer. Radiation therapy uses high-energy X-rays or other types of radiation to kill cancer cells. Chemotherapy uses drugs to stop the growth of cancer cells, either by killing the cells or by stopping them from dividing. Each treatment option has its own benefits, risks, and side effects, which should be discussed thoroughly with a healthcare provider. With the right knowledge and timely action, cervical cancer can be prevented and treated effectively. Before we wrap up, if you found this video helpful, please consider subscribing and sharing with your loved ones. Welcome to all our new subscribers. We're pleased you've joined us. Our platform thrives on community, so we urge you to interact. If you're at ease, share your stories in the comments. Your experiences can guide others facing similar situations. As we foster an environment, let's acknowledge our resilience. A beautiful Bible verse speaks to this. In Joshua chapter 1 verse 9 it says, "Be strong and courageous. Do not be afraid. Do not be discouraged, for the Lord your God will be with you wherever you go." You are not alone in this journey. A supportive community is right here. Your story could be someone else's beacon of hope. As we conclude, a reminder that early detection of cervical cancer is vital. Regular checkups and awareness are key. Be proactive about your health. Seek professional medical advice for any concerns. We hope this video has been informative. Our aim is to bring enlightening and supportive content. Your feedback is crucial to us, so share your thoughts about this video. Thank you for watching, and remember, sharing your story can help others facing similar health issues. Stay blessed and blissful until next time.